बेटा प्रेगनेंसी प्लान कर लो, उम्र बढ़ती जा रही है. If you haven't come across this statement as a newly married girl, do you even have caring relatives? Well, joke aside, today let's talk about this uncomfortable question that is casually thrown at women at every social gathering. Biologically speaking, the mid-20s are the best time to get pregnant. But then, the 20s are all about exploring life and not taking any important responsibilities and decisions. Besides, with most women marrying in their late 20s or early 30s these days, pregnancy in the 30s is a norm now. So, let's dive into what factors you must consider when planning a pregnancy in your 30s. Let's understand what an ovarian reserve is. The first thing you must know is that every woman is born with a fixed number of eggs, roughly 1 million. And as you ovulate after hitting puberty, you finish up your eggs gradually, leading to menopause in your 40s or 50s. The number of eggs that remain in your body at any time is known as the ovarian reserve, and this is different for different women. For example, your ovarian reserve at 30 may be higher than a girl with a poor ovarian reserve in her early 20s. So, beyond 35 years is known as an advanced maternal age because the quality as well as the quantity of eggs gradually decrease, and at about 40 years, the rate of pregnancy per month is just about 1 or 2%. The quality of eggs is the main determinant of genetic defects such as Down syndrome and miscarriages that increase with age. So, when you come across videos such as getting naturally pregnant at 40, remember, these are simply clickbaits and you should not fall for them, as you are simply delaying the crucial time for the treatment that you should actually get. The incidence of miscarriages goes up to 20% at 35 years of age and up to 50% by the age of 40. This decrease is more rapid in women who smoke, drink alcohol, or suffer from obesity, diabetes, PCOS, endometriosis, etc., and those who have a family history of early menopause. These factors can also lead to low birth weight and preterm birth. If you're planning pregnancy, please quit smoking or drinking, follow a proper diet, and if you're overweight, please take steps to lose weight. These are of utmost importance. Even household chemicals such as Teflon, plastic bottles, aerosols have toxins that affect your pregnancy, and as much as possible, avoid them too. In your diet, you should include more fruits, vegetables, whole grains, dry fruits, nuts, and seeds. Reduce your intake of sugar, meat, and processed food. Fish 3 to 4 times servings per week is a good option, but having it every day may not be a good idea for the risk of mercury overload. Having more than 2 to 3 cups of coffee that has about 200 milligrams of caffeine increases the risk of miscarriages and hence can be reduced. In case of supplementation, folic acid supplementation is important in avoiding neural tube defects. Vitamin D3 deficiency has shown to adversely affect your fertility, and hence vitamin D3 supplementation may be needed. Do remember, self-medication can be disastrous as vitamin D gets stored in your body and higher levels can be very harmful. For those suffering from PCOS, minoinositol has proven to be effective in conceiving. Now, when we are discussing about planning pregnancy in your late 30s or maybe your 40s, egg freezing is an option that is gaining popularity, and that needs yet another video for a detailed discussion.